Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am super excited to have my favorite, best guest ever on today, and that would be my wonderful wife, Janet. Janet, welcome to our show.
Good morning, Shawn.
Good morning. So today we celebrate our 300th episode of Health Solutions, where Team Needham discusses everything healthcare. So why don't you tell us a little bit about what Health Solutions means to you?
It's super exciting to me that this is our 300th show. And what it means to me is that we have touched people's lives in ways that we don't even know, because just being able to use technology to share information, whether it be from a physician, a patient, a nurse, a pharmacist, a nutritionist, just lay people in their industry to help each other just make better choices in our lives. So Health Solutions really started for us just by wanting to share journeys and wanting people to have access to information. So it's so exciting. Love, love, love it.
Yeah, three years later, here we are on our 300th episode. So a little bit of history about Health Solutions for those of you that don't know, if you're new listeners or viewers. In 2019, October 2019, we were working with KDRM Radio in Moses Lake, a local radio station, and we had a wonderful opportunity to stream a live program every Monday. I think it was 1 to 2, I believe. And I've been wanting to do a podcast for years. And as you guys follow us enough, you know that mine and Janet's passion is hormone replacement, one of our many passions. And I thought, well, gosh, how am I going to talk about hormone replacement, on a podcast every week? If I was going to do like one episode a week. And then the KDRM radio thing came up, and it was like, we were going to start getting guests on. And some people were like, how are you going to get guests all the time? And that's one of the things that's been the most exciting part of this podcast, is that I've been able to meet wonderful people from all over the world, and some of them even in person later. So we were with KDM, and then, and I don't believe in accidents, or coincidences. And it was perfect timing to have a podcast when my book was released, which would have been in December of 2019, actually, Christmas Eve. And right. Christmas Eve, it was released, and it was a #1 seller on Amazon when we released it in the Kindle form. And so podcast was a perfect opportunity to promote my book and talk about my book. And both the goals of the podcast and the book were to educate and empower individuals to take charge of their own health. And that's what we've been doing now for 3 years. Actually, Moses Lake Professional Pharmacy has been around for 24 years, and we've been doing that same thing with our pharmacy. So, and then fast forward, the book comes out, podcast comes out, book comes out, and then fast forward to 2020. We all know what happened in 2020. The government created pandemic happened, and then it created a great opportunity for us to have a platform to educate people about taking care of their own health. And then it was so popular that we had another show, or another weekly show. So now we do 2 weekly podcasts, and we're just loving it. We're booked out for 3 months on guests. And we're just loving it. So what do you see as the future of Health Solutions, Janet?
Oh, I hope we can do this for indefinitely. I'm sure it's going to grow. I mean, the guest list has been amazing, whether it's just a local mom and dad talking about their journey of their daughter's health, or their own health journey, or the journey of someone like Dr. Keith Smith from Surgical Centers of Oklahoma. I mean, it's amazing, from just our hometown to the world. And I feel like the journey we all walk as far as in our health and making decisions is something that is an ongoing thing. So I'm excited for our future.
I am, and my book is called Sickened: How the Government Ruined Healthcare and How to Fix It. and I am streaming a little banner on screen now. If you want to opt in for updates on that book, please send a text to text Sickened to 833-495-3426. And Janet, it looks like we have some fans watching today.
Oh, that's wonderful.
Can you see the screen?
I can see part of it. Yes.
James says, congratulations, James Dunavant. He's a fellow Liberty lover in Oklahoma, and one of our good fans, Laura Vest Turner. Congratulations on 300 episodes. You guys are the best. Laura, I think that you're the best. So awesome. We love what you're doing. Keep doing the keto stuff. So Janet, your favorite guests. And just to let everybody know, all of them are our favorite. Every single guest is our favorite. Well, no, my favorite guest is who I'm having on today. That's my favorite.
You're such you better say that, right?
Who is your favorite guest?
Well, there's so many that have touched me in my own journey of health. But I have to say, locally from our hometown, probably the story that touches me because I'm a mom is the Castro story of Lisa and Armando and their daughter. Just to update, this little girl from birth was suffering from multiple seizures throughout the day. And they just chose to educate themselves and not take the narrative that their daughter was not going to function in this world. And this little girl goes to school and is thriving. And we interact with Armando and Lisa probably weekly just because they have a local business. But the thing about it that is so touching is that these individuals chose to educate themselves and look for solutions and take responsibility, and how much joy is it to see their success.
Yeah, that's a very, very touching story. That it's a reminder how it's important for us as individuals, whether it's for our own bodies or our families, that we need to educate ourselves and take the best route for us. And that's our goal of this podcast. So how about international guests? So can you remember any favorite international guests?
Well, how far is international? I mean,
well, Canada's international. I know you helped interview a Canadian guest once.
Oh, yes. We've had a few. There's several that have helped on the mental health issues. And then we had a gentleman from Australia, too, wasn't that, for GI issues? So doctors that are practicing outside and making differences with people. You're better at their names because they're all kind of running together for me right now.
Yeah. But Dr. Pran was from Australia.
There you go.
Or is from Australia, and he is big. He's a GI doctor, and he's big on changing people's GI problems or health in general with diet. Imagine that.
Right.
Yeah. So, and I remember Marty Kendall. He's from New Zealand, I believe. We talked about a little bit about data-driven fasting and diabetes. His wife's a type 1 diabetic. Another international guest. We got another fan here. Tommy Barker, congratulations. Thank you, Tommy, for the kind words. Let's see, other international guests. Canada, Karen Martell from Canada.
Yes, we had our
talking about hormones. What's that?
Didn't we have our times?
Yeah, we did. So I know you're not usually on this end of technology challenges, but what's some ideas that you can think of for where you had or memories where you had some big technology challenges?
Well, this has been a learning curve for both of us. Technology of streaming from a radio station onto Facebook was a challenge.
Yeah, it was. You were responsible for that, and I'm sorry.
I think we opened a can of worms here. But I feel like, too, that we are living in a time where, even my mom watches YouTube videos. And so she's going to be 86 here shortly. So it's very important that we embrace it, even if it is a challenge at times. But we've overcame it, and thank goodness we have young employees and then people who are willing to dive in and help us. And then Shawn's always on the edge of learning. So
yeah, I remember that at the radio show too. It was, considering the radio show was audio only, and that's what that radio shows do. And we were trying to add video in a little station that had no room to set up cameras. And then their radio, their board, their soundboard was good for broadcasting, but it didn't have any. It was made for broadcasting, so it didn't have any outputs, so we could hook audio into something so we could stream audio. So we had to use all kinds of connections, from microphones to headphones and then put it into another microphone jack. It was crazy. And, we really thank KDRM for the opportunity to start this show in their little studio. So that was, definitely a blessing. Yeah.
And then kudos to our son, Jordan, who got the task of editing and helping splice and put things together. And he did an amazing job. And he was, 16?
He was, I know, think about,
yeah.
I mean, I don't believe in coincidences at all. As anybody that knows me very well knows that. And I say that often. But here, Jordan, before we even started the podcast, he buys this computer. He's 16 years old, and he buys this computer for like $2,200. And I asked Janet, I'm like, Janet, can he afford this? Well, yeah, he's using his own money. And I'm like, well, what is he going to do with this? Well, he wants to start doing video editing or something. And I'm like, okay. Well, next thing you know, we start a podcast, and it's like, hey, we need somebody to edit our podcast. You want to edit our podcast? And the next thing you know, he's 17 years old, and he's editing podcasts for people all over the world. I mean, how cool is that?
It was.
Yeah. So, that was cool. Let's see technology. I'll tell you. So you weren't on this one, Janet, but I was streaming from a hotel. I think I was in Rapid City, South Dakota. Yeah, I was. And I've got a big guest on, Robb Wolf. All guests are big, but Robb Wolf is on. I've been trying to get him on for 2 years. And Crystal, our chief marketing officer, is on the other end of the call, which I don't usually have somebody do that when I'm streaming from a hotel. But because he was a big guest and he was going to have we knew he had slow internet and stuff. So about 12 minutes into the podcast, and Robb is an expert on everything nutrition. Any kind of diet, he's just an expert on anything nutrition. Also sleep, actually, because we actually ended up doing another podcast with him about sleep, and sleep's more important than diet. If you follow us here, you would know that. Anyway, about 12 minutes into the podcast, power goes out in the hotel. I mean, lose all power. So, and it flashes back. And so I'm in the meantime, so it goes off. I had no idea how soon it was going to go back on. So I'm trying to get back online. I can't see anything. Even though my laptop has a battery, obviously I lost internet connection. So I didn't know how soon I was going to have internet connection again. So I'm trying to get my phone started. The power comes back up. I'm trying to get my phone started so I can get back online, get on my hotspot so I can get back online. And in the meantime, Crystal is in the background texting Robb or messaging him on the platform saying, hey, just keep talking. Sounds like there's some problems going on. So just talk about keto versus, I can't remember, keto versus carnivore diet, I think, or something, keto diet or something. And so I come back on finally. Actually, I don't know if I got on my hotspot or if the Wi-Fi finally, the router restarted and the Wi-Fi came back on, I think. I can't remember what happened. Either way, I got back on and I was offline for over 10 minutes. And I get back on and Robb is on the screen talking like nothing happened. and it was a beautiful transition. I was so glad I had Crystal on the other side, and so we always work through those technology issues. It's something we used to have to do, and it seems like every time we have an episode, there's some kind of technology issue. But when you think about all the things that could go wrong, it's amazing we don't have more issues. Another fan, Lynette. We love you, Lynette. Thank you so much for the kind words. Keep throwing around those kettlebells. What else, Janet? What else would you like to add? Any guests? I know you're a big proponent of Dr. Scott Jensen. You're the one he was actually one of the first big guests that we found. Yeah. Now, tell our audience how we found that.
So I went to school in Fargo, North Dakota, NDSU, go Bison. And every once in a while, I pop in, and watch their news just to see what's going on in my family and the life of the people that live there. And Dr. Scott Jensen was on a local TV show discussing issues that he was facing as a physician on the death certificates of people that were dying during COVID. And then he also ended up on Laura Ingraham. And so I thought, you know what, Shawn, we need to interview this doctor and see what he has to say. And at the time, he was a local senator to Minnesota, which is important because it's right on the border and close to where my family lives. And at the time, I had my mother in Minnesota, and then I have classmates and friends that live in Minnesota. So our lives are, intertwined. And so it was someone who was very outspoken and actually educated and very compassionate about his constituents and his patients. And he made a lot of sense. So I'm like, why shouldn't we reach out to someone like this and see what he has to say? And he was gracious enough to be on our show at least 2 or 3 times. I want to say
twice.
Yeah, twice.
And basically, if you guys don't know about Scott Jensen, he doctor for 30 plus years maybe in Minnesota, family practice doctor. He was the first doctor or the first maybe person to kind of expose that hospitals were getting paid extra for coding positive COVID patients and getting extra for if they intubate them. He was the first one to expose that on Laura Ingraham. And I mean, when Janet asked me to reach out to this guy, I'm like, how crazy is that? This guy is not going to want to talk to us. And next thing you know, he's on our show talking about medical freedom. And if you guys follow me here, you guys know how much I believe in freedom, individual freedom overall. But on the show, we talk a lot about medical freedom. And he is actually, after the second show, when I interviewed him, we were interviewing him about the vaccine, the COVID vaccine. And after that show, for some reason, I was feeling like, because he didn't run for another term of senator that year. And so I just had to ask him at the end, I'm like, so when you running for governor of Minnesota? And he laughed and he didn't respond. And next thing you know, he's running for governor of Minnesota now. So there is a tight race in Minnesota. Minnesota is heavily blue. And I don't care whether it's blue, red, I don't care, Republican, Democrat. All I care about is individual liberty and medical freedom. And that's why, if I support Scott Jensen because he believes in medical freedom. And I just believe I believe in candidates that support freedom in general. So anyway, he's running for governor. It's a very tight race, which is close, which people are surprised about because Minnesota has not been blue or red in a long time. So just remember that when you vote next week, remember who supports your freedom and who is for individual freedom and for medical freedom. And that's one of the ways that we can change the system is to vote for people that believe in freedom. Speaking of freedom, Mary Bowden has been on our podcast, and she is a physician down in Houston. She was on our podcast but months before she was treating COVID patients. And she's an ENT doctor. and she was a cash only, non-insurance based practice, because she realized the racket of an insurance based practice. So she stepped out and did a cash only practice. And then next thing you know, she's in the middle of treating COVID patients. And so that's what she's done over the last few years, and treated thousands and thousands of patients, and had a lot of targets and arrows on her back. But thank goodness we have doctors like her that stand up. So that's another very popular episode. We've had her on a couple times, actually at least 3 times now, I think. So other guests, Janet, what are you thinking?
Well, that just brought me into Dr. Elizabeth Vliet. She was probably one of the first that we talked to. That is she a member of the Freedom? I'm drawing a blank, but anyways, Dr. Vliet is renowned for her work with fertility and working with women's health. And she has been very gracious. I think she was on our show twice, I believe.
Yes.
But huge credentials, and has been practicing and helping people make good choices all her life. So that was really encouraging. We met her personally, and then she was on our show. So she's one of my favorite guests.
Yeah, she's awesome. We're gonna have to meet her again. Or actually, I think we're headed to Arizona next year in January. We should see if we can meet up with her. Let's see. So another guest that comes to my mind is Dr. Shawn Baker. Very popular. It was on Joe Rogan in 2015, I think, maybe 16, about the carnivore diet. And it's a very, very interesting story. Not really a surprise if we follow the money in healthcare, but he was an orthopedic surgeon. I just found out, I don't know if this is true or not, I just found out that he let his license lapse because there were so many fights against him, and he realized that he could do better by educating people on the carnivore diet without doing surgery. So anyway, I think he's in New Mexico or Arizona, and he was an orthopedic surgeon, and he would tell his patients to start doing keto diet and then come back in 8 weeks, and we'll see how you feel and if you need surgery, or how we're going to proceed with surgery, pretty much. And next thing you know, a lot of the people would lose weight, and they'd feel better, and they wouldn't have inflammation, and they wouldn't need surgery. So his surgery numbers went way down. And of course, then what happened is the system's not making a bunch of money. So his colleagues and or the local hospital system found some kind of bogus complaint against his license, and he had to fight that. And but here we fast forward 6 years later, and he's helped not only thousands, but probably millions of people on the carnivore diet. He went from promoting keto to promoting carnivore. And so for 6 years, he's done nothing but eat meat. And I mean, the guy's in great health, and he just talks how important diet is for our overall health. And of course, we talk about this a lot on the program. So Shawn Baker, look him up in our podcast, because it's a great episode. He talks about how 70% of orthopedic surgeries are unnecessary if people change their lifestyle. I mean, that's a powerful, powerful statement.
It is. So this brings me to one of my favorite stories too. And we've followed Dr. Story, who practices in Moscow, Idaho. And why Dr. Story is touching me in a way is that so many physicians and so many practitioners, nurse practitioners, PAs, nurses, pharmacists, physical therapists, I can go down the list, are so burnt out with our current system. He chose to step out and open his own practice. And has it been 5 years? I want to say it's been 5 years.
Has it already? Maybe.
But why it's so impactful is that when we've spoken to him and interviewed him, he decided that, I can step out and open my own practice and treat my patients in my community the way I feel is right and ethical. And the difference it made was, first of all, he could look in the mirror and he was happy, which meant that his wife and children flourished and his practice is growing astronomically. And he's also looked at the Surgical Center of Oklahoma and planning to open a surgical center locally in his community that people can afford to access and actually have awesome care with a local physician. And the impact to me is that here we had this physician who's super smart, super good at what he does, who was so unhappy in his current situation and decided, hey, I can do something about it, stepped out and did it. And his story is so encouraging to me because it wasn't just about himself. It ended up being himself, his family, and his community. And God bless him. And I'm super excited to see where that will lead him and his community.
Yeah, amazing story. If you guys haven't watched that episode, we streamed that in August, I believe, from Dallas at the Free Market Medical Association. And yeah, he's got a thriving practice in little town of Moscow, Idaho. It's amazing. So another fan, Sam Madera, thank you so much for the kind words, and thank you for all you do. I've been following you lately on social media. You've been getting a little vocal again on social media, and I love it. So thank you for that. Thank you for standing up for patients' rights. So speaking of Surgery Center of Oklahoma, actually, Dr. Keith Smith is very instrumental in us helping start this whole movement and even keeping our cash pharmacy going. He's a pioneer in free market medicine. And one thing that he did is, I remember, Janet, over 20 years ago, when we stopped billing insurance at the pharmacy. I mean, we were taking hits from everywhere. People calling us crazy. People saying we wouldn't be in business, in 5 years. Employees didn't believe we could do it. Patients, family members and friends didn't believe we could do it. Well, how are we going to do this? And now 20 years later, we're thriving better than ever. But I remember one time we were watching the news and we saw an interview with John Stossel. And John Stossel says, oh, well, stay tuned because I am going to have Dr. Keith Smith on my show, and he's going to be talking about his cash-only surgery center. And I'm like, Janet, check this out. We're not the only crazy ones. So I watched that probably 15 years ago. And I remember when I was working with Crystal, and thank you, Crystal, for all you do for us, our Chief Marketing Officer. When I was working with Crystal and trying to tell her some history of my book and how I came up with some of the ideas, I said, well, watch this video. Well, next thing you know, so she watched the video of Keith Smith on John Stossel. Next thing you know, she contacts me and she says, hey, I got an interview set up with Dr. Smith. I'm like, what? And that was actually officially before we started this podcast. I think I interviewed Dr. Smith in 2018. And I was just, it would have been April. It would have been April 2019. I interviewed Dr. Smith because we were in Nashville at the Dave Ramsey conference. So I interviewed him, and I'm like, after I got off the phone, I was so excited because I'm like, wow, there is a guy that's crazier than me when it comes to conspiracies in healthcare. And we've interviewed him at least once since then. No, twice, actually.
Twice.
Times, yeah. And we've toured the Surgery Center of Oklahoma and loved it. Got to meet him, have lunch with him. For those of you that don't know about the Surgery Center of Oklahoma, if you are thinking about an elective surgery, it is worth the flight to Oklahoma. People fly from all over the world to get surgeries there because it is 1/8 to 1/10 the price of what you would get charged at your local hospital. It's incredible. Transparent pricing. His prices are posted on the website. So on his website, Surgery Center of Oklahoma. Yeah. So if you need a total knee, look it up. And if it says it's $18,500, that's what it is. All inclusive. No surprises. Transparent pricing. So, Janet, what do you have to add to today's podcast?
Well, I'm super excited. This is 300, and I know we're going to go further, but I feel like technology has given us platforms, whether we're patients or because we all become patients, but giving us platforms to learn and share and actually connect. I mean, I think that's one of the other things that's so cool about podcasts is that we connect with other people in their journey and their walk, and just empowers people to make choices. And I think that's the thing that is super exciting to me, is that putting the choice back into people's hands is super important, and it gives them freedom over their life.
Absolutely. Yeah, I echo that. And if listeners and viewers, if you would like us to reach out to any guests, if you would like to see a certain guest on the show, please reach out to us, comment on Facebook, or you can reach out to me. We also stream live on LinkedIn, YouTube, Twitter. So there's no excuse not to watch. There's all these platforms that we have. So subscribe, comment, reach out. Let us know what guests you would like us to reach out to, and see if we can have them on. I would love to do that. We're reaching out, trying to find new guests all the time on anything healthcare. So let us know. And without the listeners and the viewers, we wouldn't be here today. And we've had a successful podcast because of you guys, and we have no intentions of ever slowing that down. It has really helped us to spread the word about educating and empowering our consumers just to take charge of their own health. And that's a goal of this podcast, and I think we're realizing that goal. So as always, I thank you all for tuning in and listening. Janet, thank you. I know you got to get to work today. I guess we both do. I'm just a few thousand miles away, I guess, is a problem. So thank you for being on, Janet. And I appreciate you and everything you do. And thank you for helping me with all the struggles that we've had with this podcast and technology, and helping us grow it, and letting me take the reins and move forward with educating and empowering individuals. So thank you, Janet, for all that you do.
Oh, thank you, Shawn. This is exciting.
Yeah. So thanks for tuning in. Friday, we're actually having 3 podcasts this week. Friday, do not miss out, because we will be in Arkansas with Dr. Amy Beard, and we will be discussing nature therapy. And yes, nature therapy is very important. Get outside. It's created for us. It's created for us to be healthy. So get outside and enjoy nature, and stay tuned for that podcast on Friday. I think we're streaming 9 a.m. to 10 a.m. Central Standard Time. So 7 a.m. Pacific Time. So please tune into that, and we will see you next time. Thank you for tuning in.